So good afternoon, everybody. Jim Shulman. I'm the Executive Director of the Tennessee Commission on Aging and Disability. Every so often, every quarter, we have a webinar where we kind of bring you up to speed on some things that we're working on, and then we focus in on particular things. As you look at the agenda, you can see that we're going to give you kind of a quarterly data update. We're going to talk about legislation today, federal and state. Update on some new resources, and then obviously we always allow for people to send in questions where we can get your response if you have if you got a question or something that you want to ask us about. So there's my picture, and here we go. So as I said, we talk about data on these quarterly updates, and you can see from the report that there's home delivered meals, the number of meals January to March through 2018, the third quarter. That's how many meals we served, how many people we impacted. Congregate meals, 197,000 meals, impacted close to 8,500 people. Family caregiver, we provided some help to 828 individuals. Our options program, which is a state-funded program that provides homemaker and personal care services, we hit 2,470 individuals. And our SHIP program, which is the Medicare Assistance Program, State Health Insurance Assistance Program, during that third quarter, we provided some assistance to over 17,500 individuals. That's kind of the numbers. We always provide an update. And at the next quarterly webinar, hopefully we'll have total numbers for the complete fiscal year. So, going on to federal legislation, I think the last time we had this webinar, we were in the midst of the federal budget process. That on the stage or on the screen is basically what's supposed to happen on our federal budget process. That's the typical process. February, the President submits a budget. April 15th, Congress adopts a budget resolution. The House and the Senate work on appropriations bills, and then sometime in July, hopefully, they reconcile their differences, put together a bill, and send it to the President, and then October 1st is when the new federal fiscal year starts. That's the typical process that many, many years ago we were used to. It doesn't quite work that way right now, which is okay. We somehow work through it, but that's the typical process. So where are we right now? 2018 budget. As you can see by the picture at the bottom corner of the screen, got a budget approved. People are happy. February 6th, the fifth continuing resolution passed that ran through March 23rd. And then the Congress came together and passed a two-year bipartisan budget act of 2018, which actually set out the amount, the total amount that would be put in the budget. And then they worked out, March 23rd, an omnibus appropriations for the spending of that money, at least for this federal fiscal year. So good for Congress. We got a budget passed, and good for the Older Americans Act because we got some extra money in there this year. So you can look at the slides. That will give you an update on some of the things that happened. And we're specifically, we're very, very happy for what Congress was able to do and what was sent in because there was extra money that was put in for some of these programs, 3B, home and community-based support services. We got a $35 million increase for Title 3B money. That's $35 million increase over the federal fiscal year 17. 3C nutrition services, total amount was $490 million. That was a $59 million increase, 7%. $40 million new dollars for congregate, and $19 million for home delivered meals. $59 million total. 3E, Family Caregiver Support Program, $180 million total. That was a $30 million increase, or 20% increase over what it was for the last federal fiscal year. I should always caution you that that total amount of money that was coming in, that $35 million, for Title 3B, the $59 million for 3C nutrition services. The 3 money that you're looking at is nationally. As much as we'd like to think it all came to Tennessee, it doesn't. It's distributed. We're so appreciative of the fact that there's new money involved in it, but it will be distributed in accordance with certain formulas the federal government uses to come to the particular states. So we're not getting $59 million new dollars for our nutrition services, even though that would be very nice. So going on, 3D Preventive Health Services got a $5 million increase over federal fiscal year 17. That's a 20% increase. The Ombudsman and Elder Abuse Prevention Programs, $20.1 million. That's a $1 million increase. CDSMP, the Chronic Disease Self-Management Program, stayed level this year, $5 million. And Elder Falls Prevention Program, that also stayed level at $8 million. So, again, overall, some good numbers. One more to go over, that's the SHIP appropriation. Congress restored $2 million to the SHIP program. It had previously been cut by $5 million federal fiscal year 2017. So the final SHIP funding for this current federal fiscal year is $49.1 million. Again, that's $2 million in addition to what we had last year. It's a little lower than what we had before. SHIP program, as you remember, again, the State Health Insurance Assistance Program. That's, again, the program that helps people with Medicare assistance all throughout the year and primarily through the Part D open enrollment period, which starts in October and runs through December. That's when people have the ability to look at their drug plans and make changes. So that's kind of the legislative update in terms of money on the federal side. Again, very happy with the new money. I can tell you that we have gotten some preliminary estimates from the federal government about the money that's coming to Tennessee. Our budget folks are carefully looking at it to make sure they've got it, understand exactly what it means. We're waiting for a couple of additional updates, and then we will know exactly how much we're getting. And then we have formulas internally, policy and rule-wise, that tell us how that money is to be distributed out among the area agencies across the state. So we're looking forward to getting that money out because that can mean more services to people. So, legislative updates from the federal side. So after giving you all that good news, I need to tell you that that was for this current federal fiscal year. The new federal fiscal year begins October 1st of 2018. That's the 2019 budget. The president has submitted a budget, and what he has proposed is level funding for all Older Americans Act line items, which basically means that we go back. The new money, the new increases that we got, we would go back to the original levels. So he levels it back out. At least that's what's been proposed. Obviously, Congress hasn't gotten a hold of it. We have to wait and see what they do. But all those increases, we would actually lose those increases. We would go back to the level of funding. And the president's budget has actually zeroed our SHIP program out. So nationally, SHIP would go away. We are strong advocates for the SHIP program. Last year, we helped, I believe, over 120,000 people with Medicare assistance. It's a very important program. Medicare is difficult to understand. The SHIP program provides people with information and assistance in terms of trying to make sure they understand what their insurance does, and again, specifically during the open enrollment period for Part D coverage. We consider it a very educational, very informative program, and that's why we like to talk about the SHIP program. So anyway, the federal fiscal year budget, again, for 2019, Appropriations Committee hearings are ongoing. We'll see what they come up with markups, and then we'll see what happens if they don't get a budget ready by September 30th, October 1st of this year. We might see a continuing resolution to keep the government open. Obviously, that may happen if they can't come up with something that's right before elections, so we'll keep an eye on it. But that kind of brings you up to speed in terms of where we are currently in terms of discussions for next year's budget. A couple things regarding federal legislation that has passed. the Chronic Care Act, which is an acronym for Creating High-Quality Results and Outcomes Necessary to Improve Chronic Care. That's an act of 2018. It was signed into law on February 9th as part of the Bipartisan Budget Act of 2018. Overall, what it's trying to do is make policy changes to advance the goals of integrated person-centered care, both in terms of Medicare beneficiaries and for dual eligibles. So these are good laws that are encouraging people to work to come up with better tools and strategies to better manage the care for individuals that have complex needs. Oftentimes, there's people, particularly with lots of different diseases or with different types of needs, don't get the basic tools that they need to better manage that type of problem. And so what this is doing is promoting efforts to, particularly with Medicare and dual eligibles, to come up with better ways to do that. So we'll see where it goes. We applaud that work. Obviously, better methods, better tools help everybody, both in terms of the individual patient and just the overall way of dealing with that particular type of complex situation. So anyway, good bill. We're glad it passed, Chronic Care Act. We have the RAISE Act, recognize, assist, include, support, and engage family caregivers. That was signed into law on January 22nd, 2018. Requires Health and Human Services to develop, maintain, and update a strategy to recognize family caregivers. We went to a program on caregivers just recently. Very important, as most of you know, or most of us are caregivers in some way. They do a tremendous amount of work and don't get paid for it. We're talking about people and those family caregivers who are taking care of aging parents at the same time they're taking care of kids or taking care of a neighbor or taking care of a relative or someone else. There's a tremendous amount of effort that goes into taking care of people who are in need for different reasons. And the more we can focus on that, the more we can recognize that this is such an important part of what's going on in this country, the better off we'll be. So this act brings attention to it and really starts trying to focus in on a strategy to recognize and support those folks. Legislative update on continuing on the federal side. The United States Senate Special Committee on Aging has had 4 hearings since January on various issues. They released that Senate Aging Committee 2018 fraud book that you can get access to. And they've been supportive of the Grandparents Raising Grandchildren Act. As most of you know, a lot more grandparents are raising their grandkids, and that brings together a whole set of different issues and problems. And so the Senate is working on that particular piece of legislation. I will tell you that in terms of, you got to take a look at that fraud book. The fraud book identifies scams in each state. The top 3 scams in Tennessee are the IRS impersonation scam, the grandparent scam. Somebody calls and says there's somebody's grandchild and needs money, and then you wire money to a place, and the grandchild happens to be fine. Typically, it's somebody, the grandchild is somewhere out of the country, and somebody's calling and saying that they need help. And then 3 is identity theft, people stealing people's credit cards and different, or their numbers and their information, bank accounts. Always something going on with that. We are very cognizant of that at the Tennessee Commission on Aging and Disability. We spend a lot of time trying to figure out some of this stuff and trying to come up with better ways to deal with it. So anyway, that book is helpful, and you can certainly go to the U.S. Senate Special Committee on Aging and download it if you'd like. Turning to state legislation for 2018, some interesting things happened. They are now out of session. We're going to quickly run down a couple of things that the state legislature did during this last session. Senate Bill 1777 by Senator Rusty Crowe, House Bill 1750 by Representative Dale Carr, is an interesting measure that has passed, follows in line with the Tennessee Commission on Children and Youth. It requires our agency to design and oversee a resource mapping of federal, state, and non-governmental resources and funding streams that basically go to support the health, safety, and welfare of the 60-plus category. So this is not just your typical resource guide where you look at how many assisted living facilities and nursing homes are in a particular area. This is more about trying to find overall resources and funding streams for programs that help support people who are aging in Tennessee. That report will be updated annually, and it'll be comprehensive, statewide. We'll be working on it soon, getting that information together. But again, it is not just what you would see on the street in terms of, different places to go. This is about programs and funding streams and the ability to access them. So it's basically designed to figure out what are the possibilities, what money is out there for these programs, and how do you access them? How do you put all this stuff together in one manual so people can actually utilize it? So it'll be a first. We'll be copying along with the manual that Tennessee Commission on Children and Youth put out. They've been putting it out for years. It's a very good publication. Now we're doing it for our older Tennesseans. Senate Bill 2561 by Senator Hensley and House Bill 2118 by Representative Kumar establishes the Palliative Care and Quality of Life Advisory Council. That council comes as a result of a task force that was put together. This puts it in the law, and what this task force is supposed to do is advise both the Tennessee Commission on Aging and Disability, the Governor, the General Assembly on issues regarding palliative care, including the current status of palliative care in Tennessee and also dealing with the barriers that exist to palliative care. Very important, very interesting subject. Reports will be updated annually. I get the duty of putting together the advisory council. We'll be doing it this summer, and then we'll convene them together. Very interesting subject. I know a lot of people are interested in this. It's kind of a new area, and some other states have been working on it as well. So we'll be looking at other states and then trying to figure out what we do here in Tennessee. So we'll keep you up to date on this one. This should be a pretty interesting one going on. Senate Bill 2621 by Senator Norris and House Bill 2159 by Representative Kiesling. The Elderly and Vulnerable Adult Protection Act of 2018. Last year they had a similar bill that actually started increasing the penalties for people who harm both our elderly and vulnerable adults. This does the same thing. This is a continuation. So they could get some of it passed last year. Because of the fiscal impact, they didn't get it all done, so they're continuing to do that, and this is an update. So basically, building on the success of last year's bill, this is another step in the right direction. It's increasing the felonies, the penalties for harming our older Tennesseans and our more vulnerable adults. Tennessee is actually ranked number 4 among all states for protection against elder abuse. That's thanks to our state legislature. We're seeing more and more bills that a number of us are working on with the state legislature to try to get through. A lot of thanks to the General Assembly for this work. This is trying to make sure that we take the necessary steps to protect our population. Senate Bill 1904 by Senator Yeager, House Bill 1899 by Representative Brooks. This is an interesting one. It prohibits discrimination by an employer against qualified individuals based upon disability. It did not pass. However, the request was made as they were moving this bill along for somebody to take a look at it. So the bill didn't pass because of some concerns that were left out there. I think the agreement among all the parties who are looking at this was to figure out exactly what's going on, what's out there, and somebody needs to study it. And I guess we were in the right place at the right time, and so TCAB was given the responsibility to study this over the summer, and we are supposed to report back to the General Assembly, so we will be doing that over the summer as well. New resources. We had shown you this, I believe, last year at some point, but we have a new State of Aging in Tennessee county-by-county snapshot. You can go to our website and take a look. The sheet that you have, I think, on the slide, Decatur County is just showing on the slide, but we have one for every county, and then we have an overall one for the state of Tennessee. Some new categories on this one, particularly if you look at the top, it shows you the aging demographics of the 65-plus category from 2018 until 2030, and then it's got a number of livability and healthcare indexes below that you can take a look at. Good way to kind of see what's going on with the aging population in a particular county, and then we put it all together in a state map that will show you basically overall what's going on in the state of Tennessee. Good resource, and we say that you should go take a look at it online. Something else that you all should take a look at is our senior trust, elder trust projects. So we had talked about that before, just in passing, but this was settlement money that came out of a couple of cases out of Chancery Court in Davidson County. $36 million is being injected into the system over the next 3 years in 4 specific areas: senior housing, senior dental, senior transportation, and senior legal assistance. These are projects, again, funded for 3 years. These are areas that have gotten attention but just don't get a lot of funding, and so the idea was, thanks to the Chancery Court and a lot of efforts by a lot of people who put a lot of time into this, was to try to come up with statewide programs that could really start moving the needle on some of these areas. So those 4 categories are very important. That's why they were selected. A lot of money is going out into these specific categories with a focus on direct services to people across the state. So more about this later. The contract started on April the 16th, so we've been basically out for just a little while. The projects are getting started and underway, and hopefully by the next time we talk, we will have more updates on this particular thing. This is a big one. You can find out more by going to the website at the bottom. And that is it. That's our update. If you have questions, you certainly are welcome to send them along. There's information right there that will tell you who to call. You can certainly send them to the website. We will get back to you. Or, just get in touch with us. Even if it's not questions about what was presented today, if it's just overall questions regarding aging, or you have questions about the resources, or any of the stuff that we do at the Tennessee Commission on Aging and Disability, always feel free to give us a call. We are here to help, and if we can't provide the direct help, then we can usually tell you where you need to go to get help. Thank you for your time, and we'll talk to you next.